Okay. Yeah, thank you so much for having us. And Redox, thank you. Um, Thank you to everyone on the front lines at the health system and all of the vendors who are taking the call and disrupting their day-to-day operations to really come together and help support COVID-19. So for those of you who are not familiar with Epion, we work with many different health systems across various specialties. And we've been doing this and checking in patients since 2013. When Redox approached us about a trial and giving health systems the opportunity to use our product at no cost, we were thrilled. We sell like that every day. We put the burden on us to prove out our product. And we were really excited to have the opportunity to work with Redox and offer you a solution to help you on the front lines and help support your COVID-19 initiatives. So the way that the Epion platform typically works is our bread and butter is collecting clinical data and putting it exactly where it needs to go in the chart. So we work with patients before the visit, during the visit, and after, really working to create a digitally connected patient population. So we're not proposing a full Epion solution today, just like the other vendors. We have worked to understand the needs and what you're currently going through and how we can best support you. And we think doing that before the visit is most impactful at this time. So we have interviewed our customers to, again, get an understanding of how we can best support them. And what we heard, we have many different organizations, but they all said similar things. Providers are quarantined. They need to do a quick shift to telehealth. They need to triage their patients. It's not normal operations, and they need to respond to that. They're nervous for their staff and also their patients' health. So it's a different world, as you know. And what we've taken away from that is that COVID-19 has truly been a catalyst in a quick shift to telehealth. So how we want to best support that is helping the triage protocol. It's changed overnight. So we are helping your staff get on board with that. It's a quick switch to telehealth. And also, how do you communicate the new expectations to the patient? So you might be canceling their appointments, directing them to the emergency room, telling them not to come in. So you need a platform for that messaging. So our response to the needs today, how do we handle that shift to telemedicine? How are we helping you communicate to your patients? How are we helping you to triage? We're doing that by sending a custom message to the patient. So you're going to have a variety of different patients and needs, and you are going to have a platform that allows you to message your patients appropriately. We're going to take Epion's bread and butter of what we do every day and helping patients check in, and we're going to push it in upstream. So we're going to encourage the patients to check in at home on their own device. If they are coming in for an appointment in your office, we are reducing the amount of time that they are in the office, and of course, helping eliminate contamination in the office. And then a custom message after they complete a check-in. So what does the patient do now? We're going to allow you a platform to communicate to that patient. So it starts with custom messaging. This is just an example of a few different messages we could ping the patients with, letting them have instructions of how to complete their telehealth visit or that their appointment has been moved to telehealth. So this is just one example of a workflow. There are a variety of different workflows. I'm just focusing on one today for time. And this is an example of someone whose appointment that was previously scheduled is now a telehealth visit. So we're going to ping the patient. We're going to send them a text message. There's nothing for them to download. They don't need to create a login and password. It is going to just be a streamlined two-step authentication to identify who that patient is and get them started in their check-in process. So we're collecting contact information, so demographics, collecting that upstream, putting that on the patient to complete the information ahead of time. Patients can sign your paperwork. So if it's time to sign HIPAA, patient agreement, financial authorization, consent to treat, that's all available on the phone for the patient to review and then sign directly on their phone. And we're going to collect information about the patient's visit. Why are they here today? Why do they want to be seen? What is the review of systems, and also history of present illness? Collecting this information ahead of time. If it's telehealth, you now have access to this information before the telehealth visit. If the patient is coming into the office, you now have access to this information before that patient comes into the exam room. So obviously there was not a need for a COVID-19 screener several weeks ago, but times have changed. So we have put together a COVID-19 screener, allowing the patient to go through and complete this questionnaire before they come in. From here, this is how we're helping you triage the practice, and then can message the patient appropriately on next steps. You don't want a patient who is scored high coming into the office. You may want to direct them to the emergency department. So getting started, again, like the other vendors out there, this was an initiative to get you a solution quickly, to take what would be most relevant to this time and deliver a solution that's a little bit outside of our standard platform. So we are ready to do the work. We understand resources and timing are definitely tight. So Epion is going to take on that lift. They are going to do the build. We are ready to work with you. We are a cloud-based solution. So as things die down, as needs change, we can certainly look into building out that more robust clinical solution that we're known for. But again, we just wanted to get you a solution that was going to be most impactful for you at this time. So we are quick, we're nimble. We are working with our customers every day. We understand information is changing every day. So how we can be most impactful, we're ready to do as quickly as possible. So if you're interested in a trial, we're waiving costs for 3 months. Again, thank you, Redox, for the opportunity to present the solution to you all. And if there's any questions, we'd love to be in touch.